Ever get this weird feeling like there's a whole lot going on inside you that you're totally oblivious to?
Oh, all the time.
It's kind of freaky when you think about it. Like, what if there's some serious stuff brewing under the surface and we're just walking around clueless?
Well, there actually is. Really?
Yeah.
Well, high blood pressure, for instance. Or hypertension, as it's clinically known. It's global health issue, impacting over 1 billion people. That's a huge chunk of the population.
Wow, 1 billion people.
Seriously. And here's the kicker. A lot of those folks don't even know they have it.
So they're just going about their lives totally in the dark.
Pretty much. It's like a silent adversary. It's actually often called the silent killer because it often doesn't come with any obvious symptoms.
But if it's silent, how's it a killer?
Well, because even though you might not feel it, it's quietly doing damage inside, increasing the risk of things like stroke, heart failure, and kidney problems down the road.
Yikes, that's scary. So today, we're diving deep into hypertension. We're going to lay it all out, what it is, what makes it so dangerous even when you feel fine, what causes it, why it's often symptomless, and what we can do to prevent and manage it, based on all the info we've gathered.
Let's break it down. First things first, what exactly are we talking about when we say hypertension?
Yeah, good question. I mean, I've heard of it, but I'm not really sure I get it.
It's all about the force of blood against your artery walls as your heart pumps.
Okay.
You can picture your arteries as pipes carrying blood from your heart, right? Blood pressure is simply the pressure of that blood pushing against the walls of those pipes. And hypertension. That's when that pressure is consistently too high for a long period of time.
Okay, that makes sense. So when we get our blood pressure checked and there are those two numbers, what do those actually represent?
Right, those two numbers. The top one is the systolic pressure, which measures the pressure when your heart beats, contracts, and pushes blood out. The bottom number, the diastolic pressure, represents the pressure when your heart relaxes between beats.
Okay, got it. So when we talk about healthy versus unhealthy blood pressure, what are the numbers we should be aiming for?
Well, a reading around 120/80 is generally considered normal. When it creeps up to 130/80 or higher consistently, that's usually flagged as elevated blood pressure. And 140/90 or higher is typically when hypertension is diagnosed.
So it's not just a one-off high reading.
Exactly. It's about consistency. We all have spikes occasionally, but it's those persistent elevated readings that are concerning.
So let's say someone's blood pressure is consistently high, but they feel totally fine. Why is that a problem? What's actually happening inside that makes it dangerous?
Imagine those arteries, those pikes. Again, they're supposed to be elastic and smooth to let blood flow freely. But if they're constantly under high pressure, they can stiffen and narrow over time.
Like old pipes getting clogged up.
Precisely. And that makes it harder for blood to move through.
Which means the heart has to work harder to push the blood through.
Right. That's exactly it. Your heart is a muscle, and like any muscle, if it's overworked, it can get strained and weakened. Like, think about lifting weights that are too heavy all the time. Eventually, your muscles will give out.
That's a good analogy.
Yeah.
And it's not just the heart that suffers, right? The other organs also get affected because they're not getting enough oxygen-rich blood.
Absolutely. The reduced blood flow can affect pretty much every organ in the body, making them less efficient. This is where those serious health risks come in. We're talking about things like heart attacks, strokes, vision problems, even kidney failure.
Can you break down those risks a bit more, just so people really understand the stakes here?
Sure. Heart attack occurs when the blood supply to the heart is blocked, often due to narrowed or blocked arteries. Stroke happens when blood flow to the brain is disrupted, potentially leading to brain damage. Vision can be affected because those tiny blood vessels in the eyes are very sensitive to damage from high blood pressure. And kidney failure, well, kidneys rely on a good blood supply to filter waste from the blood, and high blood pressure can damage those delicate filtering units.
So hypertension really is a silent threat with potentially devastating consequences. It's kind of mind-boggling how many people are affected globally.
It is. It's estimated to contribute to about 10 million deaths worldwide every year. That's a sobering statistic.
It really highlights how important it is to understand this condition and take steps to manage it. So let's talk causes. Why does blood pressure get too high in the first place? What makes someone more susceptible?
Well, it's not always a simple answer. There are often multiple factors at play. Broadly, we talk about two main types of hypertension, primary and secondary.
Okay, so what's the difference?
Primary hypertension, also known as essential hypertension, is the most common type. It develops gradually, usually over many years, and it's usually a combination of lifestyle factors and genetics.
So it's not like there's one single cause.
Right. It's more like a perfect storm of different things coming together. Then you have secondary hypertension. As the name suggests, it's caused by another underlying medical condition.
So if you treat that underlying condition, the high blood pressure should go away.
Ideally, yes.
Hmm,
Things like kidney disease, hormonal disorders, certain medications, even sleep apnea can all cause secondary hypertension.
got it. So for primary hypertension, it sounds like there are a lot of potential risk factors.
That's right. And some of them are more common than others. Things like high salt intake, being overweight or obese, lack of physical activity, smoking, excessive alcohol consumption, chronic stress, genetics, and even pre-existing conditions like chronic kidney disease all increase your risk.
It's amazing, actually, how many of those risk factors are kind of, I don't know, built into modern life. Like processed foods are everywhere, and many of us have desk jobs that keep us sitting for hours.
It's true. The way we live today can make it easy to slip into habits that aren't great for our blood pressure.
Okay, so let's talk about the silent killer aspect again. If this condition can be so dangerous, why doesn't it always come with warning signs?
It's tricky because often, especially in the early stages, there are no noticeable symptoms. Your body is really good at compensating even when your blood pressure is quite elevated. You might not feel any different at all.
So there are no telltale signs that scream, your blood pressure is dangerously high.
Well, sometimes when blood pressure gets really high, people experience things like severe headaches, blurred vision, dizziness, or nosebleeds. But these are not reliable indicators.
So you could have dangerously high blood pressure and not experience any of those things.
Exactly. And on the flip side, having those symptoms doesn't necessarily mean you have high blood pressure.
So how do we know for sure? If we can't rely on how we feel, what's the best way to know if our blood pressure is in a healthy range?
The only reliable way is to have it checked regularly by a healthcare professional. It's a quick, painless procedure. You can get it done at your doctor's office, at many pharmacies, or even at home with a blood pressure monitor. Early detection is key.
Knowledge is power. Okay, so we know getting checked is important, but what can we actually do to prevent high blood pressure in the first place, or manage it if we've already been diagnosed?
There are some really effective lifestyle changes that can make a big difference. We often talk about 5 core habits. The first is eating a heart-healthy diet.
So lots of fruits, vegetables, whole grains, that sort of thing.
Exactly. And being mindful of saturated and unhealthy fats. Another key habit is reducing your salt intake.
I've heard that's a big one.
It is. It's not just about how much salt you add to your food, but also being aware of hidden sodium in processed foods and restaurant meals. Then there's regular physical activity.
How much exercise are we talking about?
Aim for at least 30 minutes of moderate intensity exercise most days of the week. That could be brisk walking, swimming, cycling, anything that gets your heart rate up.
Okay, so diet, salt, exercise, what else?
Limiting alcohol and quitting smoking, if you smoke, are crucial for overall heart health and for maintaining healthy blood pressure.
And of course, managing stress. It seems like stress is linked to just about every health issue these days.
It really is a major factor. Chronic stress can definitely contribute to elevated blood pressure over time. Finding healthy ways to manage stress, whether through sleep, mindfulness, hobbies, or spending time in nature, can make a real difference.
All great advice. But what happens if someone makes all those lifestyle changes and their blood pressure is still high? Is that when medication comes in?
Yes, if lifestyle modifications aren't enough to bring your blood pressure down to a healthy range, your doctor might prescribe medication. There are various types, like ACE inhibitors, beta blockers, and diuretics. They all work in slightly different ways to lower blood pressure.
It's important to remember that needing medication is not a sign of failure, right?
Absolutely not. It's about working with your healthcare provider to find the best approach for you. Medication can be a very effective tool for managing hypertension and reducing your risk of complications.
Great point. So as we wrap up this deep dive, what's the key takeaway for our listeners?
If you haven't had your blood pressure checked in the past year, please make an appointment. It's a simple test that could save your life. Early detection is essential.
So true. And as you reflect on everything we've discussed about hypertension, what it is, why it's dangerous, what causes it, and how to manage it, think about which of those lifestyle habits we talked about might be relevant to your own life. Maybe there are small changes you can make to support your health and well-being. It all starts with awareness and taking those first steps toward a healthier you.
Couldn't agree more.
All right, that's all for today's deep dive on hypertension. Thanks for listening, and we'll catch you next time.
See you then.